Okay, well, welcome everybody. Thank you for joining our webinar today with Mr. Gauri Cottonini and also Dr. Nikki Shah. Before we start, I see a lot of you have already. If you could please mute your microphones and also your screens. For those of you who don't know me, my name is Paul Harris and I'm the owner of Crown Dental Burrs. We are proud partners with 3 global dental manufacturers. The first manufacturer is Frank Dental, who are a German independent dental burr manufacturer, producing over 4,000 diamond and tungsten carbide burrs. We are also proud partner for Coracama, who are an Italian quality instrument manufacturer who also produce 4,000 hand instruments. Finally, and most importantly, we are also proud partner for DentaSonic, who are an innovative Swiss orthodontic manufacturer, providing quality solutions for both manual and mechanical interproximal production. I would just like to introduce to you now Mr. Gauri Cottonini, who is the export manager for DentaSonic. Gauri lives in Milan, but spends most of his time traveling between Europe and North America, where he manages a distribution company and consults in export and development. Over the last 12 years, Gauri has achieved great knowledge on real patient needs, specifically promoting minimally invasive technologies for patient protection, sees him lecture at many dental congresses and exhibitions around the world. With his global perspective and specialist knowledge, Gauri is a valuable asset to the dental community as he continues to be at the forefront of industry trends and advancements in helping shape the future of dental care. Welcome, Gauri. I would now like to introduce to you to Dr. Nikki Shah. Dr. Shah graduated from Barts and the London Dental School in 2011. Dr. Shah focuses the majority of his clinical time and research on orthodontics, in particular, clear aligner therapy and composite restorative dentistry. His passion for minimally invasive cosmetic dental treatments has helped many patients achieve the smile of their dreams. A philosophy of treatment whereby patients achieve aesthetic results yet retain as much tooth structure as possible is the driving force behind the enthusiasm for the profession. Dr. Shah joined ProAligner in 2020, taking on the role of providing quality education and support for the dental community. Dr. Shah believes clear aligners should be a tool that can be utilised by all dentists with the correct training and mentorship. In 2023, Dr. Shah was introduced to DentaSonic and truly believes it has revolutionized the way he performs IPR. I will now hand over to both Gauri and Dr. Shah. Thank you.
There I am. Sorry. I've had a technical problem with my computer. I'm very sorry for this. As I was saying, I would like to thank, well, first of all, good evening, everyone, and thank you for joining us tonight or this morning, according to which part of the world you're connecting. Special thank you to Crown Dental Burrs and to ProLiner that in the persons of Paul Harris and Nikki Shaw that have requested and organized this webinar with me. And of course, thanks to my company, to DentaSonic, for all the support that we are receiving in developing this project worldwide. So as Paul briefly introduced the argument, I've been evaluating worldwide and trying to understand what could we really bring on the market in terms of specific solutions for patients' needs. So when we opened this project more than 12 years ago, we started to identify that there were very specific needs that patients were requesting. And honestly, the medical community was usually working in other directions because of what had been their trainings and what had been their, let's say, what you're used to do over the years. And it's very difficult maybe to look from a patient's point of view for a clinician. So we have started to dialogue with doctors in a different way. And we wanted to find, and we achieved in finding, companies that have developed solutions based on solving patients' needs and using minimally invasive new technologies with an incredible quality and incredible results for the patients. And DentaSonic is definitely one of these companies. So when I needed to understand what was IPR, and we're talking about interproximal reduction, in some countries it's called IPC, interproximal correction. In some countries, it's called stripping, but we're talking always about reducing the enamel around the tooth in order to achieve space. And in order to do that, over the years, many different solutions have arrived on the market. And very specifically, we are talking about burrs, we're talking about discs, and we're talking about strips. What is important to understand is not the product itself, but also to understand how to use every single product in a safe and efficient way in order to protect the patient's enamel and to protect the work of the clinicians that perform IPR on a daily basis. And so I needed to research what was the patient's experience. And of course, what do we do today? We go online. We normally ask Dr. Google that knows everything. And I strongly suggest all of you to maybe go online every now and then and try to check what are the opinions worldwide of people that have received interproximal reductions. And then if you have the opportunity, maybe you can also click on images. And I'm going to show you now just a small portion of all the images that you can find around the world on the internet. And that's why my introduction and presentation, it's called, Why Should We Pay More Attention When We Talk About IPR? And so the first thing that I would like to share with you, I'm continuing to having technical problems with my presentation. I'm very sorry. I don't understand why. Okay, here we are. The first thing that I would like to show you are these images that you can find on the internet. I don't think that the patient signed up to finding himself with this kind of problem in his mouth, because most of the products that you find on the market to process IPR are very difficult to control. And especially if as a clinician or as a professional in this sector, you don't have the sufficient training and expertise in order to process correctly the use of these instruments, you can definitely create damages to the patients. And so, as I told you in my introduction, if you type in wrongly implemented IPR damages to the patient on the internet, you're going to find a lot of these pictures. I don't think that this is a natural shape for teeth. And especially the diastema that we find in the middle over there, it's not something that is natural for the patient. Unfortunately, this diastema has been caused by over-reduction, and now they're trying every single effort to close that space, but that space is not going to close itself, no matter how many rubber bands and how many brackets you're going to put on that patient. because the natural biology of the tooth has not been respected. And so the only way to fix these problems is to work with veneers or to work with composite buildups. So aesthetically, same thing for this picture over here, and same thing also for this picture over here. And here we're talking about fracturing the contact points. It's very important when we process IPR that we always follow a very specific and simple protocol, allowing, first of all, to open the contact point without breaking the corners, without fracturing the contact points, and allowing you one strip after the other, according to the thicknesses, as we will introduce you during this webinar, you can achieve in reducing the exact amount of enamel, protecting the patient's enamel, but without compromising the natural shape of the teeth. Another thing that I would like to talk about is safety, because most of the patients, if you read their comments online after their experience doing an IPR procedure, were very much concerned about safety. And I always try to explain to the doctors I meet worldwide, how can you talk about safety when you work in these conditions? What if maybe the assistant touches the elbow of the doctor, or somebody in the office touches the elbow of the doctor while he's working? Or what if the patient needs to cough or moves without warning the doctor? And I'm sorry for the next image, but this can definitely lead to problems like we can see here. So I'm showing you these pictures because it's important for you to understand that reducing space, reducing enamel in order to gain space is not something that needs to be taken not seriously. It's a serious procedure, and definitely it has to be processed using something that can definitely be safe, accurate, predictable, and comfortable for the patient. And that's why when I was looking for a solution, I found DentaSonic. And why can I tell you today that DentaSonic is safe, accurate, predictable, and comfortable? Because DentaSonic has developed the IPR line based on two different scientific studies. They have asked 2 universities in Germany. First question that they asked is, how much enamel can be safely reduced on a tooth in order to avoid problems to the patient? And the second question is, can you please tell us what is the patient's experience while he's receiving an interproximal reduction of his enamel? And what is the difference when you use a disc, when you use a burr, and when you use a manual strip, or when you go to automatic IPR? And based on what these researchers have produced as results, they have developed a line that stays exactly inside the safety parameters that were established by these 2 universities. And you can find these studies on our website. So it's a company that has switched the priorities. So first of all, we're talking about patients' enamel safety. Of course, we have to provide a precise and accurate treatment. Of course, patient's comfort. And last but not least, time saving and satisfaction for the doctor. But they have to be in this exact order in order to not have the problems that I have showed you in the opening of my presentation. So there is a very, very simple protocol, but I will go inside the protocol in the incoming slides. I will just make it very fast here because we're talking about a quick and safe through the contact point procedure with a 0.1 saw, then a gentle correction reduction with a 0.2, then the active part of IPR from 0.3 to 0.5, and then, of course, a perfect final polishing procedure with the poly strips. But as I told you, I will go into detail with our protocol in the incoming slides. These are the 2 universities that I have been talking about before. We're talking about the University of Darmstadt and the University of Heidelberg. And what is important here, why am I showing you this picture? Because first of all, it's important for you to understand what is the patient's experience when he's receiving an interproximal reduction procedure. So In the next slide, I'm going to show you the difference from a patient's point of view in receiving a manual IPR interproximal reduction or an automatic interproximal reduction. And this is a very useful slide that I show on a daily basis when I talk with doctors all over the world. So you have a very simple chart. The horizontal line, you have 9 different orthodontists. These orthodontists are differ by age, experience, body shape, and body weight. And on the vertical column, you have the amount of force that is discharged on a patient during an interproximal reduction procedure. Then you have the circles that are the manual strips, and then we have the squares that are the automatic IPR from DentaSonic. And as you can see, the amount of pressure and of force that is discharged manually on a patient compared to using a handpiece with a very specific protocol that DentaSonic is able to provide you is able to take out most of the discomfort that usually is discharged on the patient during an interproximal reduction procedure. Just try to consider that orthodontist number 4 was a Japanese orthodontist, was a very tiny lady that used both manual and automatic IPR. And as you can see, how much is the difference of the amount of force that is discharged on the patient when she processes it with her hands or when she delegates responsibility of the pressure to a handpiece in order not to have this kind of problem while she's processing the procedure. So I would like all of you to keep this information in mind. You can find these slides on our website, and it's very important for you to consider from a patient's point of view what we are receiving when you are processing an interproximal reduction. And then the second question that I told you is how much enamel can maximally be reduced on a tooth in order to avoid over-reduction? Because we're talking about not only aesthetic problems like the ones I have introduced you in the beginning, but over-reduction, if you go and read literature, can bring to very severe problems in which dental hypersensitivity is only the very smallest problem that can be caused, although for many people is a huge problem. Over-reduction can lead to gum resorption, but over-reduction can also lead to root resorption. And so if you have a solution that allows you to stay exactly inside not more than 0.3 millimeters, which is, by the way, the half of the original enamel thickness, you will be able to achieve the amount of space that you need to achieve on that patient without compromising the health of that tooth and creating the problems that I just described. And that's why DentaSonic has developed a line that stays exactly inside these safety parameters. Another useful piece of information that I would like to share with you, because visiting dental practices around the world, I often hear many patients complaining that doctors are proposing to extract teeth in order to gain space, in order to move maybe a frontal crowding. And most of these patients don't want their teeth to be removed unless there's actually a clinical reason to remove those teeth. And so the same university, the University of Heidelberg, informs us that if we stay inside the 0.3 millimeters of space of reduction, and we consider that on the maxilla we have a total of 11 contact points, it is possible to achieve up to 6.6 millimeters, and 6.6 millimeters is a huge amount of space on an arch. So I don't really see, unless there is a clinical reason or a health reason to extract that tooth, why do we have to extract teeth in order to gain space to solve crowdings? We can perform a controlled interproximal reduction that will allow to achieve the result that the patient wants, but without damaging the mechanics of that mouth and without damaging the function of that mouth. That is one of the other problems that is caused by over-reduction or wrongdoings in extractions. Another thing that we have to consider is that the same amount of space, just a little lower, 6.2 millimeters, always considering 0.3 millimeters of space on the arch, is achievable also on the mandible. So 6.6 millimeters on the maxilla, 6.2 millimeters on the mandible, and we can definitely achieve in obtaining the correct amount of space in order to solve any kind of crowding. Please visit our website, visit dentasonic.com, and you will find the scientific articles that will allow you not only to understand the safety of our line of products. This is a study from 2022 by the University of Rome. And another very interesting article came out in 2024. And I suggest you to take a picture and to go and look for this article, because we have asked to take the first 4 companies distributed worldwide to evaluate their strips, attach those strips on a continuous working machine that had them work for 2 hours, and you will see what happens to most of the strips on the market after 2 hours of working continuously on a surface, and what happens to the strips by DentaSonic. I don't want to anticipate anything, but I can tell you that you have an excellent ratio between price and quality if you start using DentaSonic, and this will help you save hundreds of dollars during the year in your procedure, or of pounds, or of anything else. Sorry, I have a more technical problem. Okay, so I don't think that I need to show you people what an aligner reproximation tracker is, but it's very important for me to give this piece of information, because maybe you don't believe me, but around the world, a lot of doctors are not trained properly into reading these charts. And so when they see that maybe at tray number 10, that you have to reduce 0.5 millimeters, they just start with a 0.5 strip disc or burr, and they go inside directly with the 0.5. Please, you have to believe me, this happens on a daily basis. And so the fact that we're able to supply you a safe solution with a very simple protocol that I'm going to introduce in a moment, and make you understand that if you see 0.5, you have to always start from a 0.1 that leads you to a 0.5. When you see 0.3, you have to start from a 0.1 and get to 0.3. And by following very simple rules, you'll be able to protect your work, protect the patient's enamel, and protect results on the long term. So we have talked about aligner IPR prescription, so please help me, allow me to introduce you the DentaSonic IPR procedure. It's a very simple and standard procedure. We start with a 0.1 saw. 0.1 is the only saw that you will have inside the aligner prescription. The angles of the saw are not acute angles, but it's more shaped like a wave. And it's very important because this saw absolutely is impossible with this saw to damage soft tissues. So if the tongue gets in the way, if you press too much and you fall on the gingiva, if you go towards the lip, there's no way that this saw is going to cut the soft tissue of the patient, but it's sufficiently flexible. And with the correct amount of abrasiveness, and we're talking about 15 micron, that will allow you, and I'm going to show you in a short video soon, how you can open the contact point without transferring any damage to the patient and obtaining the sufficient amount of space to introduce strip number 2 that will grow from 15 to 25 micron. And will not have the saw anymore because it will only work sideways, reducing the correct amount of enamel in order to lead you to the active part of the IPR procedure that normally is between 0.3 and 0.5. You will have a maximum diamond coating starting from 40 to 50 to 60 micron. DentaSonic does not manufacture and has stopped manufacturing years ago because we have worked years as manufacturers for other companies with diamond coatings above 60 micron. This has been a choice of the company. They have decided that they did not want to contribute in damaging and harming patients. And so we have informed all the companies that we're not willing anymore to produce strips with more than 60 micron of diamond coating. And why 60 micron? Because if you consider the 0.5 strip, and I have told you in the introduction that the maximum enamel that you can reduce on a tooth is 0.3 millimeters, you will see that the 0.5 will reduce 0.2 on one side and 0.2 on the other side. So you will always be 0.05 micron under the safety parameter that allows you absolutely not to create any overreduction and any damage to the patient. Please remember, and you can double check, go online, look for scientific publications, look for feedback from patients. Diamond coatings of 90, 120, and 150 microns for interproximal reduction completely destroy the patient's enamel, and that can lead to all the problems that I've been introducing you since the beginning. And then, of course, a 0.4, we're talking procedure number 4, step number 4, excuse me. We go back to 15 micron with an aluminum oxide strip with a 15 micron diamond coating that will allow you to properly contour, respecting the natural biological shape of the tooth and working very specifically on the surface. And if you go on our website, you will be able to find the microscope images of what is the surface of the tooth before, during, and after the IPR procedure with the DentaSonic strips. How do we introduce this on the market? Well, you have a basic ortho aligner set available because doctors were asking for something very specific to work only with clear aligners. And so since several years, we have on the market the basic ortho aligner set where you have the necessary strips for any aligner procedure from 0.1 to 0.5, 3 finishing and polishing strips, a measuring gauge, because it's always proper to double check what you have actually achieved or what you still need to achieve during every change of strip, a tip extractor, and our reciprocating handpiece. Of course, for those doctors that don't work only with aligners, but work also with brackets, work with class 2 restorations, work with composite buildups in the posterior sectors, work with veneers, work in prosthodontics. So for all those doctors that need to process IPR, but not strictly related only with aligners, we have the professional kit number 2, where you're going to have the same assortment of kits of strips that you have in the basic ortho, but in addition to those, you have also the single side coated strips left and right, 3 different polishing strips, a second head for the handpiece. So when you're lubricating and cleaning the first head, you can continue working with the second head, 4 burrs that are specific to contour, add-ups in composite, or to remove bracket glue, measuring gauge, a sterilization tray, and a couple of manual strips by DentaSonic for those tip-ups that maybe you need to do at the end of the procedure. It's very important to follow, and I strongly advise you to read the instructions manual inside our kits, because we have specific instructions. There's also some very short videos that will help you understand how to insert properly our strips and how to remove properly our strips. Please remember that we supply 1-year and 2-year warranty according to your choice, but the warranty kicks in if all the procedures are respected, especially the procedures for sterilization and lubrication that needs to be performed on a daily basis. Just allow me 2 very quick videos. This is the 0.1 strip. This is a courtesy of Dr. Abdelkahim Geriani. He's one of our opinion leaders. He works out of Dubai. And This is the opening of the contact point with our handpiece with water, with a reciprocating handpiece. And this is exactly what happens. As you see, you don't have any pressure transferred to the patient. There is a very limited transfer of vibrations that can be extremely discomforting for the patient. And you just need to open the contact point with the 0.1 saw. There's no damaging, respecting the natural biology of the tooth. And in case it slips or the patient's tongue gets in the way, the acute angles are not present because, as I told you, it's shaped like a wave and it will not harm the soft tissues. So this is exactly how the 0.1 strip works. And this is exactly how you can process the opening of the contact point. After that, you can start working with the 0.2 strip that allows you to increase that space a little bit. As you can see also here, there's no discomfort for the patient. There's no excessive pressure applied to the patient, and very few micro vibrations transferred to the patients. We can then skip to the 0.3, and you find all of these videos on our website and on our social medias, and you can also refer directly to Paul Harris at Crown Dental Burrs if you need to receive them in another way because you don't have access to our website or to our social media. So everything is available to you. Please always remember to check your progress because the measuring gauge helps you exactly to verify how much you have reduced and how much you still need to reduce according to the aligner prescription that you received or according to your need in base of what you're doing. And then you can continue with the 0.5 strip. Please remember that all the strips may rotate 360 degrees. And this is very comfortable, especially for the upper posterior sectors, without inserting all of your hand inside the mouth of the patients. I always talk about patient experience because, as I told you in the beginning, all my projects were based on patients' bad experiences. And so I've always tried to introduce very clever solutions with a very high quality profile and the minimally invasiveness that I could find on the market. I think you have understood how our strips work, but definitely Dr. Nikki Shaw is going to go into detail. Please allow me the last couple of slides. Please remember maintenance. You have to guarantee a long life for your reciprocating head. You have to clean the head with oil after every daily use. And also for this, we have specific videos available on our website that will tell you exactly how to lubricate the pieces, because if the proper maintenance is not processed, of course, warranty terms do not apply. So please, we want the long life of your reciprocating heads and of our hand pieces. We have two different sets of strips. We have a predefined aligner assorted set from 0.1 to 0.5 and the finishing and polishing strips in 12 pieces. You also have them in 5 pieces, but they don't have the finishing and polishing included, but we have the 5-piece for the finishing and polishing. And then, of course, every single strip from 0.1 to 0.5, double-coated, single-coated, left or right, finishing and polishing, we all have them in the 12-piece blister and in the 5-piece blister. My presentation is finished. I truly thank you for the invitation from Crown Dental Burrs and from ProLiner. I thank you all for the attention. If you have any specific question for our company, you can email me directly at gori.cottinini@dentasonic.ch. If you want to get in contact with Crown Dental Burrs, you can just scan the QR code here. Thank you again, all, and have a wonderful webinar.